Good afternoon. I'm Diana Vance Bryan. I have the privilege of serving as chair of the Hennepin Healthcare Board of Directors. On behalf of the board, I would like to welcome you today to Hennepin Healthcare's virtual annual meeting. So on today's agenda, we will learn about actions related to the Community Health Needs Assessment. We will get an update on the progress on the health equity and equity journey, and we'll hear about caring in the time of COVID-19. As you are watching, you can send us your questions or comments by clicking on the Q&A or question and answer box on your screen. We will try to answer some of your questions and comments this afternoon or address them to the extent we aren't able. We will summarize those and responses, and those will be sent to you or posted. So if we have your email address, this session is being recorded, and we will send the recording with the Q&A summary to you. If you don't have your email address posted with us, then you can find that information online under hennepinhealthcare.org by going to the About Us section. So this is an extension today of a regularly scheduled board meeting. So I mentioned welcoming you on behalf of the Board of Directors. I'd like to start by introducing the Board of Directors. So up here you have their pictures and names. In the interest of time, I won't read them all, but no, it's a dedicated group. We have community leaders here who are really volunteering their time and talent to this organization, as so many volunteers are. So we thank them for what they are doing. We also want to acknowledge and thank the Hennepin County Board. So you may not be aware that Hennepin Healthcare System is a subsidiary corporation of Hennepin County. We do partner and collaborate with the commissioners, and they have certain reserved powers. So we'll just want to acknowledge and thank the 7 commissioners. You might note that 2 of those commissioners pictured here, Chair Marion Green and Commissioner Irene Fernando, also serve on our board of directors. I want to mention Commissioner Mike Opat too, because he was instrumental in 2007 in creating the healthcare system, and he served on its board. In addition, Commissioner Jan Callison spent many years serving on this board and on its various committees, and we are grateful for their service. One thing that Hennepin Healthcare does is it gets input and valuable insights from a number of committee sources and community sources, I do want to acknowledge that we have board committees. So in addition to our board members serving on those committees, we have community volunteers who also join us on those board committees. We have community members as well serving on the Research Institute board, on the Healthcare Foundation board, and more recently, we have created the Public Research Advisory Board and the Community Advisory Board. Those were created with the purpose and intention of getting more insight from members of the community and hearing their voices. And so, again, another opportunity. It's really valuable to the organization, to the board, as well as management, to hear that input and helping and guide the organization in making its decisions. 2020, wow, what a year of transition. So February, we started out with welcoming Jennifer D. Cubelis as our new Chief Executive Officer. We selected Jennifer, as I said at the time, because of her deep passion for the mission of Hennepin Healthcare System, as well as her mission or passion for the community we serve. So really dedicated to that community and has years of involvement with it. We also selected Jennifer for her leadership skills and for her record of engagement and collaboration with the community in working on issues and projects to improve the health and well-being of those served and community members at large. So with that, I'm going to turn it over to Jennifer so that she can talk with you and her team can join her in visiting with you about the other matters on the agenda, including the equity journey and the community health needs assessment.
Thank you, Diana, and thank you to everybody who is both serving on our boards and committees, to our patients and our staff, who we know that this work all matters to, and to everyone who's joining us today, as well as those who might watch this afterwards as we post it on our website. I wanted to start off first by talking a little bit about Hennepin Healthcare and what we do here. We care for over 2,500 people every day across our system. That's a huge lift. We are an essential system of choice. We provide exceptional end-to-end care for everyone in our community, regardless of income, regardless of insurance, from the most severe trauma situations to wellness and new babies and new births. As a teaching facility, we have the best and brightest across our organization, and they are teaching the workforce, the future workforce across the state of Minnesota and often nationally. Through our research, we're a cutting edge of healthcare discoveries, leading exceptional care into the future. And you'll hear today that COVID-19 has been no exception to that. We have been on the cutting edge and continue to be on how do we learn about this disease, how do we treat it to the best of our capabilities, and how do we drive healthcare forward. We are also a leader in emergency services. We are a leader in community connections, about getting out into the community. So really that healthcare without walls, that ability to go out and serve people in the community, meet their needs, listen and learn. And I think you'll see several examples of that today. A few other bullets on here is we are also one of only 2 critical burn centers in the region. I would mention our hyperbaric chamber that we are well known for. We are the poison control center for all of Minnesota. There is so much more beyond this list that I can't even mention, but it really does speak to the criticality and the essential functions that are provided here at Hennepin Healthcare to ensure the health and wellness across our community. End to end, our Hennepin heroes bring their incredible hearts and minds to work every single day, working hard for not only our community, but for each other. And we hope to highlight some examples of that today. As important as what we do is who we serve. There are a number of ways to look at the data of services, and this is a snapshot based on our biggest front door, which is our emergency department. We serve, as I mentioned, people of all incomes, with or without insurance, with a diversity of backgrounds and a diversity of lived experiences inside and outside our walls. As you can see in the graphic here, 68% of the people we serve are people of color. Creating a system where everyone belongs, everyone feels welcomed and cared for is mission critical. For us to meet the needs of our community, we often start with one question, highlighted here. What are the most important health issues for our community as defined by our community? I've asked Amy Harris-Overby, our Population Health Director, to walk us through how the community guides our work and how we respond to changes in our environment once that work is underway. With that, I'll pass off to Amy.
Thank you, Jennifer. So as a nonprofit hospital, Hennepin Healthcare goes through a process every 3 years to conduct an assessment. And that really is just an intentional act of engaging and listening to a community. And from that process, then identify priority areas for action or frame then in an implementation plan. So you can see here we're on a 3-year cycle. And in 2019, it was in fact a year where we were executing work from our previous needs, as well as conducting again that intentional act of listening and understanding. And so the process we went through in 2019, if you go to the next slide, really was a unique process for us where we looked at existing information, public health information, data about our patients, but we also wanted to make sure we really were listening and engaging with community to hear their voice about what they perceive to be the most important health issue in the community. And for us, our community in this space is defined by the communities and the cities where the majority of our patients live, which ends up being about the eastern half of Hennepin County. And so through this process, we talked with 138 individuals. They were people that had roles of official prominence as leaders, and we talked to informal leaders. And what you see here is we had a nice representation, I think, reflecting the diversity of the communities we serve. And the themes emerged, they're noted on the right side of that slide, that there was a lot of commonality in the themes around accessing care, cultural care, health equity, and then trust between our health system and the community. And so we brought these inputs from these interviews into a process in the summer of 2019, where we brought community together. We worked through all of the inputs and used a prioritization process for them to be able to tell us what was the most important health need in the community. And through that, they identified a singular need, which is access to culturally responsive care and services. And with the input from community, looking back into the interviews that we did, looking at best practices, we constructed this implementation plan late in 2019. And it's to be a reflection of the work leading into 2020 and through the year of 2022. The way this plan is constructed is the element of increasing community partnership and voice sits across the top, which we think is essential for the way in which we go about this work. And it's exactly what community has asked of us. Additionally, we noted the need to increase knowledge, to develop our workforce, to implement new service models, and help improve navigation to services. So when we look at the programs we have at place within Hennepin, we have some tremendous legacy programs that we would hold up as be culturally responsive care models already in play. A great example of that is a Key Parity, which is operating out of Whittier Clinic. The Mother Baby program is a program that we are now working to expand through the establishment of the Red Leaf Center, which will open in 2021. But we also are taking on new work and projects that really is focused at how do we better understand and listen and work with community and really tackle some important issues. And the one I'm going to tell you a little more about today is the Somali Mental Health Access Community Partnership Project. This was an initiative that we launched in partnership with community when we noticed in our data here that we were concerned that there were challenges to accessing mental health services, particularly for our Somali community members. And so we entered into a unique process where we brought community together with the medical community, used a design approach to really get into the heart of these issues. And so through that, we identified two major opportunities for action and improvement. And one was this, the framing that the lack of cultural awareness limits staff empathy and breaks patient trust. And I think this is a great example where, because of the approach we took and the way we brought ourselves as equals to the table with our community, we really heard and understood and got to the heart of these kinds of issues. The second issue that we identified was the presence of stigma very significantly in our Somali community, and how that stigma gets in the way of having conversations about mental health. So with the teams working together using this design process, the teams then set out to say, what could we do that would try to address these major opportunities that were identified through this work? And so the teams put together a process which, as with many things in the year of 2020, had to be adapted to work in this unique pandemic time we're living in. So ultimately in August of 2020, the teams executed an event called Eat for Understanding, which was really kind of a simple concept, but it really brought together community members and from the Somali community and individuals working in the medical community for a shared meal and shared dialogue that would allow us to explore and raise awareness, to build cultural understanding, and attack and address some of the stigma issues that exist in mental health. And so it was a prototype event, is what we called it, that really let us test a concept that we think has a lot of potential. And its potential is in part because we think it was shaped from the very beginning with the voice of community telling us what was important to them. So the findings from the prototype and feedback from the core team that's been working on this issue have brought forward some recommendations for how we could move this work ahead and build it forward into our implementation plan for 2021 and 2022 that is a great example of how we can build out more culturally responsive care and services. And so with that, I'm going to hand it back to Jennifer.
Thank you, Amy. So you can see how delivering culturally responsive care has been identified by our community as a need, and how together we're working alongside community to realize that. You also heard a little bit, and you'll hear a little more as we talk through COVID-19, how because of the pandemic, we've had to switch gears midstream. Based on learning, we've had to switch gears midstream, but our commitment remains to walk alongside community to realize optimal health with our community. Our Hennepin Healthcare Board has been walking this journey with us for a while. In late 2019, the board identified that we would be led by an unwavering commitment to equity, and you'll see that on the left-hand side here. That drives all of our work along operational pathways to the goal of leading the equity in healthcare services. That was incorporated into our 2020 plans. And the events of 2020 further catalyzed our commitment to health equity work. COVID-19 tragically confirmed and accelerated the health disparities that are present, as you can see by the confirmed positive COVID-19 case counts. We have seen the disproportionate impact not only in our data, but within the walls of the hospital system, day in and day out. That was quickly followed by the murder of George Floyd on May 25th. And the response in our community, right outside our walls, highlighted how real and how raw the wound of inequality and injustice suffered by our communities of color continues to be. Institutions like ours in healthcare cannot be silent, and we will not continue to be a part of the problem. We need to own this as healthcare providers. We need to commit to action and commit to real change. Healthcare needs to show up differently. We need to rethink healthcare and realize better outcomes together. Our board responded with this resolution. The Hennepin County Board of Commissioners declared racism a public health crisis soon after COVID-19. The Hennepin Healthcare Board responded through this resolution, and what this resolution does is it's a call for action. It's a call for action for our whole organization to build out a more defined, bold stance on health equity and what we're going to do. It really is our call to action, our commitment to action, and that end to end across our organization, that commitment needs to be realized. So our journey started long before the year of 2020. However, it has absolutely exacerbated and accelerated our efforts. It is the beginning of our journey. This is not the end, and our commitment is to stay with this. We have re-engaged community discussions across the community to listen and learn on an ongoing basis, not a once in and leave, but to truly ask the questions you heard Amy reference earlier and continue to explore what's working and what's not working and build the healthcare system of the future that we all want to see. In addition to that, we've done a landscape review, which is looking at, you heard the mention of Akiparati, about the mother-baby program, about other work. There is incredible work happening across the organization to address health inequities, to make sure that we're hitting outcomes and that we are the system that the community needs us to be and wants us to be, and that we all are here for. What we found is that we have programs that are doing incredible work. What our commitment is to connect the dots across those programs and realize how do we learn from those and bring them to size and scale. So it's not a hope that you connect with a program that works for you, but that our entire system is built with that same modeling going forward. We are also working to define priorities. We will give you a chance as a part of this annual meeting to weigh in on those as well. So there will be a link attached to the report on the website where you can poll and provide us input on where do you think our priorities need to be. And finally, you've heard our commitment about creating an action plan. We will have annual goals that continue on this journey into 2021 based on what we've learned from 2020 that are looking out and pushing the system with transparency and in partnership with community to drive this work forward. We are in the process of hiring some leaders. We have, if you saw on the earlier slide, some new executive team members. Tanya Hampton joined us in the last month as the leader, our Chief People and Culture Officer. And you'll see in a slide about how that really drives the people resources across our organization and the culture with which we approach this work. We also have posted a Chief Health Equity Officer and are actively recruiting for that position, which will not be one person's responsibility, but it will help us stand up a team that moves this work forward and commits to keeping it visible in all decision-making across the organization. With an organization-wide focus on health equity, the work that Tanya's leading on the left-hand side of this, that people and culture work, is the internal work that we need to do as an organization to make sure that that culturally responsive care that Amy referenced from community is realized. Pairing that work with our employee engagement, our quality, our patient experience, and at the end of the day, the operational excellence that we strive to have, exceptional care without exception, and that delivery effectiveness is access to care easy. All are puzzle pieces that will get us closer to that realizing health equity for and with community. What you see down below is our commitment of where we're starting. We're starting with committing to people, to developing a culture of belonging, of inclusion and equity, to working with community to drive outcomes that improve the health of all, and to rethink and redesign healthcare through the community's lens, creating a system that works for the people it serves. I hope you hear that this is a relentless focus on equitable health outcomes for Hennepin Healthcare. This is absolutely critical work, and you can see that many people are at the table, but we welcome more. And throughout 2021, we will continue our community listening sessions, our engagement with boards and committees, and we'll bring together voices to help guide our work. I'd like to now look at the impact of COVID-19 and to turn this over to our executive leadership team, who will share, beyond the health equity work, what did we see with COVID-19 in the year of 2020? How did our Hennepin healthcare heroes stand up to the challenge? And how did we work to impact community in a positive way? Please roll the video.
In late January, we opened our hospital incident command system to focus our resources on what we were starting to think might be a significant system-wide emergency. 6 weeks later, we expanded the command center staff to include broad leadership from across the organization, and we started meeting every day, more than once a day. On March 10th, we sent our first of what became a daily communication update to all 7,000 employees, and 3 days later, launched an internal COVID-19 website to keep everybody up to date on what was happening. Things were moving and changing at an unbelievable pace. We secured our campus by closing some entrances and separating access points, protecting our staff and patients from the virus. And we came together as a statewide healthcare system, working with hospitals across Minnesota to share information about bed and ventilator availability so we could share resources across the state and support as many patients as possible. During this intense period, we needed to move fast to respond to the rapidly changing situation. In mid-March, we canceled all non-essential, non-emergency clinic visits. To be able to continue to care for our patients, we quickly ramped up virtual care, including telemedicine and live video visits. Our information technology department supported the technology needs of more than 1,500 employees as they transitioned to working from home, and we moved from in-person to virtual huddles and team meetings. To preserve personal protective equipment, redeploy staff to support our ICU needs, and to keep patients and staff safe, we canceled or rescheduled non-emergency procedures and surgeries in late March.
Hennepin Healthcare has played a major role for Minnesota during the COVID crisis. Our staff have been front and center on the front lines. We've had the highest volume of COVID patients of any Twin Cities hospital during the initial surge of cases. We've cared for more than 900 inpatients so far this year. We created and implemented inpatient surge plans that included opening a new intensive care unit when we were at peak capacity. Like all hospitals across the state and country, obtaining and maintaining personal protective equipment was critical, and the ingenuity of our staff led to creative solutions like the PPE buddies to help keep our frontline staff as safe as possible. Rapid, accurate testing became critical, and our labs ramped up quickly, implementing on-site testing and adding equipment to become one of the leading labs in the state, with some of the fastest test results back to the patients and staff. To serve our community, we opened a dedicated testing clinic on our downtown campus and added community testing sites in Whittier, Richfield, and Brooklyn Park, and we've tested more than 80,000 people across our community to date. Our home care nursing staff and community paramedics have provided on-site testing in congregate care facilities like shelters and long-term care facilities, and they work together with the state and Hennepin County to meet those needs. Our physicians and advanced practice providers are also researchers, and we have been a partner in research and therapeutic treatments, including convalescent plasma, losartan, remdesivir, and a national staff surveillance study.
Hennepin Healthcare is a leader in medical education. Early in this crisis, we decided that preparing tomorrow's physicians meant preparing them during a pandemic rather than separating them from the opportunity to learn. As a result, we did not pull back our resident trainees, but rather taught them how to keep themselves and their patients safe. Our role as a teaching hospital in this community is to prepare tomorrow's workforce for anything that comes their way. The next novel virus, the next global pandemic, and to be leaders along the way. While residents continued to work, medical students were temporarily pulled back by their home institutions, as these medical schools recognized that masks, gowns, and protective gear were in short supply. Clinics closed and surgeries deferred, creativity emerged as we sought to redeploy Hennepin Healthcare staff to meet emerging and unpredictable needs. Our Human Resources Department worked hard to match staff who were willing to step in to the multitude of needs across our system. The hospital experience changed for everyone, including those hospitalized patients who didn't have COVID. All hospitals across the state restricted visitors to protect both patients and staff. So we turned to technology to help. We provided iPads and other communication technology to connect patients, their care teams, and their families. Throughout this pandemic, our employees continued to deliver the best possible care and support despite a sea of challenges. This is really hard work. To better support our staff, we offered a myriad of mental health and coping resources, including an employee wellness center with food and support, a telephone warm line to connect with a mental health professional, and team support calls for psychological support. Our cafeteria created a pop-up critical supply store so employees could get necessities, such as toilet paper, fruits and vegetables, and other supplies that were in high demand in local grocery stores. And we partnered with a local hotel to offer downtown accommodations for staff who were concerned about exposing family members to infection, those needing to quarantine, and for others who simply needed a respite from a challenging workday.
COVID has the potential to be financially devastating to hospitals. When we canceled elective procedures and postponed clinic appointments, we lost critical sources of revenues. However, we maintained our workforce substantially intact. That was needed to respond to the pandemic. We purchased equipment and supplies to prepare our organization for public service. We expanded workers' compensation eligibility and paid employees who needed to quarantine at home. Then we looked inward, very deep. We moved quickly to reduce expenses by cutting the CEO and executive salaries, holding the 2020 incentive programs, slowing down hiring into open positions, And across our organization, employees took unpaid furloughs. These were extraordinary actions of good stewardship. Let me add that we have been very fortunate to receive Federal CARES Act funding, Minnesota Department of Health grants, and funding from Hennepin County. And the generosity of the community has been gratifying as donors have stepped forward to support the Hennepin Healthcare Foundation, both financially and in kind, with personal protective equipment. We have not faced the financial challenges of this pandemic alone. Most important, we've had our employees and we've had you.
Unfortunately, health disparities that have victimized communities of color for ages have now become more pronounced and more deadly during COVID-19. An example, in Minnesota, African Americans account for 6% of the state's population, but have been 19% of the confirmed cases of COVID-19. The statistics are similar for Latinx communities. Early in the crisis, we created a community messaging work group that has been routinely meeting with representatives of the communities that we are privileged to serve, with the goal of hearing what is working and, very importantly, what is not working for our communities. In response to what we've learned, we have rewritten many of our educational materials. We have created videos in the languages that our communities speak. And we have established routine check-ins with our communities, our patients and their families to better understand what are the emerging issues and trends that they are seeing. We are partnering with our communities through this pandemic together. We've conducted a basic needs survey to understand what our patients were experiencing. And as one example, when we learned that telemedicine, which is so important to getting care during the pandemic, when telemedicine services weren't working for all people, we made changes to lower the barriers to getting telemedicine and to reach out to people in different languages to start the calls and the video sessions so that people can access care. And now, after careful consideration and thorough planning, we have been able to invite people back into our facilities for their care here at Hennepin. It is safe to get your care here. Our staff is masking up. We do screening at the door. Our communities are coming into our facilities, which have been thoroughly cleaned at high-touch checkpoints. We're using appropriate social distancing. The safety of our patients, their families, our communities, and our staff are of utmost importance. We're here for life. We're here for you and with you during this pandemic, and we're here for you and with you during better times as well. We are here to join you on your journey to health and wellness.
Wow. I hope you heard the hearts and minds that are incredible across Hennepin Healthcare and the amazing work that our teams have done throughout the year to respond to what community needs, to respond in real time, to get creative, and to absolutely support each other. Hennepin heroes end to end. One of the biggest learnings from COVID-19 for us was when it's all hands on deck, and when care is what we're focused on, we can do incredible things together and in partnership with community. And we want to take those learnings into 2022 or 2021, my apologies, to make sure that that is how we provide healthcare. It is learnings that we don't want to lose. With that, we're going to open up for some questions. I have one question that has already come in. And that question, if you have other questions, please feel free to post them. If we don't get to them all today, we will do a follow-up and make sure that those go on our website. This is less than ideal. We had hoped that this annual meeting was in community with each and every one of you and interacting and dialoguing. But 2020 has not allowed us to do that. And we do want to have that engagement. The first question that came in was from Sarah, asking about highly engaged workforce. what are the steps to ensure opportunity for current employees? And that's a pretty deep question. If you saw on our people and our culture and the work that Tanya Hampton has joined us to help us lead, that can go in many different directions. I will say we've had an equity advisory committee that has been advising every step of the way. We're taking the input from our community forums and our meeting and capturing those themes, and we're building those into our equity planning. And likewise, we're hearing from staff every single day about what matters to them. I was exiting a few weeks back and had a team from Family Health and OB Services, our obstetricians, that stopped me and said they had great ideas about how do we help moms give healthy birth, moms staying healthy, giving that baby the best chance possible, and what we could do to lean into that work differently. As we hear those ideas, that is what we build into these plans, and we don't just solve them in one department. We figure out how do we solve them and spread them across the organization. So as our plans are built out, we will absolutely communicate to employees about how to engage. And then I'd step back another step to say one of the things we've heard from community is making sure that our staff are representative of community. So that's another undertaking under that people work. It is to say, let's make sure we are representative of the people we're serving. And how do we build that into our recruitment, to our retention, to our career pathways work as another way to engage employees? And finally, I would say training is critical. None of us on this journey are going to get this work perfect. This is new territory. It is new work for healthcare to figure out how does healthcare look so that everybody gets to that optimal health. So as we have that learning, it's also training. It's providing tools, supports, and resources to our teams to make sure they have what they need in order to deliver the care and that vision that we've set forward. So multifaceted, but communication, transparency, and keeping this visible publicly will be some key deliverables for us. I'm looking to see if we have any other questions that are coming in. Not seeing any. Oh, there's a couple coming in now. What are you learning about your usual care during the pandemic that may inform how you plan services in the future? So absolutely our usual care. Access is an ongoing issue. Some of the work that you heard on the video around telemedicine and telehealth, the ability to connect with providers in easy, accessible ways to community makes a difference. If I can grab a quick meeting or a quick appointment and I don't need to leave my employer, if I don't need to worry about childcare, if mental health and addiction are easily accessible, no matter where I am and in the privacy and comfort of my home, those are all key metrics about new types of care that we need to figure out how do we make sure that is available to everyone. And some of our early learnings with that was around it was not accessible to some. And so we used data to say who is using it. And if we looked at the people we served and we saw disproportionately the folks that are using it are in certain buckets and we're leaving some behind, that right away told us we had to change our methods. And one of the things we did was connect interpreters into our telemedicine opportunities in order to make sure that it was available to some folks that we saw in the data it wasn't available for. So usual healthcare, not having everybody on site, being flexible, getting into community where we need to. There's a lot of work. And again, it's in that feedback from community members and patients that we're seeing every day about what works. Another question that's come in it's from Mitchell. It's good to hear the priority that Hennepin Healthcare Services is now placing on equity, diversity, and inclusion, and not making the mistake that Wells Fargo CEO Charlie Scharf made with his recent comments about a lack of Black talent. As you move on the equity journey, will HHS conduct an equity audit? Great question, Mitchell. And we have done some of that self-assessment already. And it was actually a slide because we were worried about time that we pulled out. But that slide was that self-assessment that tells us where do we have some skill sets and we can always improve, and where are we falling drastically behind. So that is some work that we are happy to bring forward very transparently with community to say, here's an action plan that's being built behind that to improve upon our skill sets. And I think that that will be a iterative process as we constantly look at how are we doing, where do we need to get better, and that input from community is critical. Another question came in about payers, insurance changing how they reimburse for care. So this is an opportunity for us. I think the crisis of 2020, if we look at the federal government and the deficits that they're running in response to COVID-19, similarly, the deficits that are running at the state level, one worry is that oftentimes where you see those cuts is coming across health and human services. And we can't afford to have those cuts, but it is also about looking for those efficiencies in how do we get to the right outcomes in a means that works. So part of that is talking to the state of Minnesota. It is talking to our payer partners and saying, if we are all committed to getting better outcomes for lower costs, how do we need to do that? And taking those COVID-19 learnings in order to be able to right size. As many of you have seen, there's healthcare cuts happening across our community right now. And if services just start going away, we're going to be in worse shape and spending more money than if we do it very intentionally with partnerships. So the same partnership you've heard us talk about with community is partnership that we need to have with the payers, the funders, and the policymakers in order to both stabilize healthcare, but also rethink healthcare and lean into the future of where we want to be as a state. I'm looking for other questions. It looks like maybe that's it. With that, I just want to say a quick thank you. I want to thank you for those of you who have joined us and who are watching this at a later time for making Hennepin healthcare a priority and for being here just by virtue of looking at these meetings, giving us input, advising us along the way. We know that you're committed to the health and well-being of our community. We want to thank you for your partnership. We're not always going to get it right. We have talked a lot about the journey that we're on and that the journey that we are committed to continuing on. And those open, honest, transparent conversations are going to help us all realize the health and the healthcare system we want for our community. We look forward to 2021. We look forward to continuing to learn and partner together, and we are grateful to each and every one of you. With that, I will pass back to our chair, Diana.
On behalf of the board, I would like to thank you for sharing your time today and your feedback, which is so valuable to us as we move forward. We need to hear from you. We need your guidance to get it right. So we're on this journey. We hope we're on the journey together, and also want to thank the entire Hennepin Healthcare team and all of the heroes out there. We appreciate you. And with that, we'll declare us adjourned.